Okay, so back pain is a collection of specific problems, and those specific problems behave very differently to each other, and in fact can behave kind of opposite to each other as well. So what we'll do today is we'll look at a very specific tool that's designed to solve one particular problem, and then we'll look at two reasons or two situations why that wouldn't work, and in fact may make the situation worse. Because again, there's no such thing as just do this one exercise universally for back pain, or this one routine. It never works like that. So let's have a look at some practical examples as to why that would be. So if you're familiar with the work of McKenzie, we'll understand that things like posterior disc bulges and herniations, we can use positions of extension to help those disc bulge and herniations heal, because that position, through hydraulic pressure, will pull that disc bulge and that herniation back into the disc. So we're talking about positions, things like here, we talk about McKenzie push-ups here, we come right up here into that end range extension for extended periods to help that disc bulge and that herniation heal. So if you've got 80% of your disc height left, then that McKenzie approach may work quite well for you. For a lot of people, it won't be too aggressive, so you may need to back right down to this sort of level, or even just this level to kind of mitigate that risk. But also, that sort of approach isn't going to work for everyone with back pain. So that's a good idea in most cases, trying to restore some extension. If someone has stenosis, like a particular type of narrowing of the nerve canal, particularly behind where the nerve sits, and you put them into extension, then they're going to run out of space for that nerve, and it's going to start to pinch into that canal, and it's going to pinch that nerve by being in that extension. So again, we're trying to solve the problem of back pain, but we have one problem which is a disc bulge, another problem which is the stenosis. They behave opposite to each other. So people with stenosis, actually being in flexion will give them some relief, and decompression will give them some relief. However, if we put them into extension, we're going to try and treat a disc bulge, and actually close that gap up, and you'll start to irritate that nerve. So even being in this sort of position here, or even here, I've had people with stenosis before, that's even too much for them, even though they have got like a disc bulge going on, but because they've got the stenosis, we can't use that disc recovery position for them. Another thing to think about also is the neurology, what the muscle's up to. So if you're familiar with the work of Yanda, you understand a concept called lower cross syndrome. People tend to sort of sit with their hip flexors or overuse their hip flexors as a solution to generate stability around their hips and lower spine. So being in this position for them, let's just say they haven't got stenosis, but they have got a disc bulge. So this could be the right tool for the disc bulge, but they stay in this position for 1 to 2 minutes and the back starts to really cramp up. Again, because that neurology, that lower cross syndrome, in this position here, favours those tight hip flexors. So again, we've tried to solve one problem, but we've created another. So now their back's going to cramp out because their muscles don't like being in this position, so we can't use that tool for them. So you can see, like with one tool, so using extension or disc recovery positions, now for someone with just a disc bulge or herniation, they could feel wonderful. 3 to 5 minutes of that position might alleviate their pain symptoms, help their disc to heal as it pulls that material back in. However, someone's got stenosis, being in that extension position there is going to close that gap up around that nerve and make them feel worse. And if we have someone who's got confused movement engrams neurology, and they tend to overuse their hip flexors, although they might have a disc bulge, help the disc bulge, you'll then heighten the problem of what the hip flexors and lower back are up to. They start getting into a fight with each other. You might find me in that position, it's healed the disc bulge, it's helping heal the disc bulge, but it's setting off their hip flexors and causing their back to cramp up, and they're going to have a big flare up because they're in that position. So again, we need to get away from the idea that back pain is just one analogous, amalgamous kind of thing that you can just treat with random exercise. It's a collection of very specific problems, and those specific problems have rules around what we can and can't do and what we should be doing, especially in terms of risk versus reward and just selecting the right tool. Because again, any treatment or exercise that we use is just a tool. So we must understand the problem first and then just select the right tool to solve that problem. Simple as that.